I'm going to talk to you now very briefly about the ethics of research on non-human animals. The history, sadly, of research on non-human animals was full of really horrible abuse of animals that often took place. Research done often without very strong justification, often without minimizing harm or producing a huge amount of suffering, along with some research that was very, very valuable. This history really got a lot of public attention with a Life magazine article published in 1966 called Concentration Camps for Dogs. This article really gave rise to a lot of public concern and produced the Animal Welfare Act. That gave rise in terms to the NIH policy for animal care and use that created institutional animal care and use committees, IACUCs, to provide independent oversight of research using non-human animals, very analogous in a lot of ways to the IRB system that we have for human subjects regulation. Further regulations were developed by the Public Health Services regarding live vertebrate animals. There's an Office of Laboratory Animal Welfare within the PHS that requires an animal welfare assurance by institutions that are going to do research on live vertebrate animals, and a number of animal welfare regulations governed by the USDA. Now, the standard justifications for doing research on non-human animals is its value. Research that impacts and improves human health might not be possible any other way without using non-human animals. And so the real value of this, and the reason why it's done, is to help produce knowledge that will improve human health in different ways, either through the prevention, treatment, or amelioration of disease. In addition, the use of non-human animals may make it possible to go forward for particular treatments in place of children or other humans, or reducing the risk of children or other humans in research studies. So, for example, in vaccine research, very few parents would feel very comfortable giving vaccines to their children in clinical research if that had not first been done in animals. In addition, finally, and something that people often forget, is that some of this research could also have value for its impact and improvement on the treatment of non-human animals. So veterinary treatments and other sorts of things that make it possible to treat non-human animals and to save their lives and prevent or treat their conditions and diseases might take place, which could not otherwise be accomplished without research on non-human animals. There are also ethical concerns about non-human animal research. From a deontological point of view, in terms of rights and duties, and especially in terms of rights, there is an approach to this, to issues about rights when we think about animals, and people think about animal rights as a movement. Now, interestingly, Immanuel Kant, who is the quintessential deontological theorist and really the most important philosopher dealing with deontological ethics, he grounded rights and where rights come from in the ability to reason. And therefore, for Kant, non-human animals actually don't directly have any rights. The most prominent deontological theorists in favor of animal rights in recent years has argued that Kant's account is inadequate. After all, infants don't have the ability to reason either, but we nonetheless think that they have some rights, which is something that Kant would have not really agreed with. Therefore, there needs to be something besides the ability to reason that grounds the rights that individuals have, and he grounds them in the ability to have a subjective experience, the subjective character of experience, something that it's like to be a subject, to look out in the world. And therefore, since non-human animals have this capability just as humans do, animals have, therefore, rights just as humans do. There's also potential utilitarian justification for how we treat animals, and it means that from a utilitarian perspective, that is a perspective which really focuses on maximizing the net benefit over harm when you think about what actions are the right actions to undertake, is whether or not the suffering of non-human animals outweighs the benefits to humans and other animals. And that's really what you have to do. You have to weigh, if we allow this suffering of these non-human animals, what are the benefits both to humans and non-human animals that will be produced, and then try and weigh them out. And this approach means that you couldn't justify needless suffering, only suffering that really makes sense in terms of weighing benefits and burdens would be something that would be allowable. One concern about the utilitarian justification that's been raised much more frequently in recent years is the poor track record of non-human animal models in terms of generalizing well to humans. We can cure cancer in mice in a lot of different ways, and we see a lot of newspaper reports being very enthusiastic about the latest treatments that work great in mice. Murine oncology is a great field, but very poor record of concordance between these preclinical animal models and human clinical benefits and burdens. And John Ioannidis, who's a faculty member here at Stanford, has written a lot about the challenges of the way in which we do use non-human animal models and leap to things that may not be really justified or really do all that much good, which would raise questions about the value, not of all non-human animal research, but at least some of it. So fundamental questions are whether or not the proposed research uses of non-human animals are beneficial or not, and if they are beneficial, are some uses simply unacceptable? A very famous case study in 1984, a head injury study at the University of Pennsylvania. They restrained baboons, and then they had a helmet on that allowed them to drive a piston into their skulls to produce brain trauma, and then they would study their behavior and study them for a couple of months before euthanizing them and then evaluating what the status of their brains were. The Animal Liberation Front broke in and stole videos from Penn, and they released an edited version that showed painful surgeries without anesthesia, broken arms being held up, inadequate pain relief across the board, insulting comments that were treating these primates really pretty horribly, a number of other violations. An investigation took place. Penn was fined $4,000, and their research funding for this particular project was not renewed. The researchers in this research continued to maintain that they did nothing wrong and that the 26-minute video was taken out of context. But some of the things in those videos, which you can see now, PETA is the one who wound up putting that out into a documentary, and it's available on the web. It's pretty clear that there were at least some pretty fundamental violations that took place. So fundamentally, how do we think about the ethics, and how do we weigh these trade-offs between wanting to respect animals and treat them well with the importance of the fact that sacrifices produce tremendous benefits for human health, potentially human health or animal health. And there are generally 3 R's that are seen as the fundamental ethical framework for thinking of research on non-human animals, though there's a 4th that what I've already described should also be introduced. The 3 standard R's are replacement, that if possible you should use organisms or material that are not conscious or sentient and replace higher animals with lower animals. Reduction, you should use the fewest number of animals needed, consistent with sound research design. And refinement, you should minimize the incidence and severity of the harm to the non-human animals as much as possible, given the goals of the research. So if you use as few animals as possible, try to avoid having animals that can experience suffering as much as you can, and minimize both the incidence and severity of the harm to those animals, and ensure that in general they're well cared for. That's the traditional framework, and that IACUCs oversee and monitor to ensure takes place. A 4th R is that the research done should be reproducible. It's unethical to harm non-human animals on work that is of low scientific value and unlikely to be reproducible. And it's really important that we probably do a better job, given John Ioannidis' findings, of our assessment of research on non-human animals.